know, the people who have multiple sclerosis are people like you and me. They are oftentimes young or middle-aged adults. They are in the prime of their life. They're pursuing careers. They're raising children. They're exploring the world. They have adventures to be had, dreams to be realized. And MS is an intruder.
MS is not a part of any of my family history that we know of. So when MS was a suspected thing, a lot of it was, oh God, and what does this really mean? What really is MS, and what does this really mean for me, and how can this be happening to me?
The symptoms of MS are as varied as the nervous system's dynamic functions can be. So people can have numbness, they can have pain, they can have weakness, they can have problems thinking. And the problem with multiple sclerosis is that over years, untreated, unattended, people accumulate loss.
Kind of grieving the loss of who I thought I was and what I thought I was, and understanding, that there's a new path to take. It's different, it might not be the path I wanted, but I have to go down there nonetheless.
At our MS center, it's sort of the job not only of me as the neurologist for the patient, but the job of a whole team of people to bring people back to that path, to realize those goals and those dreams.
So you go from a progression of the first time I heard, we think you have MS, where I had a husband, no children, it was a hard time, to I have 2 children, doing really well, but we've got progression and you have it. And that forced me kind of all over again to deal with the kind of the grieving, the no I don't, yes I do, I'm really depressed, I'm really angry, and then, okay, this stinks, sucks, but you got to deal with it and move forward.
I'm going to have Marty talk to you today.
Multidisciplinary or holistic care for the multiple sclerosis patient is a much more effective way of getting people to manage their disease successfully. And by successful management of MS, we're talking about being able to work on a day-to-day basis, being able to cope with symptoms, and I'm not just talking about medicines, I'm talking about a good exercise program, a healthy way of eating, to have the right counseling and psychological support when MS interferes with their best moments.
The MS Center, unlike the average Joe, even though the average Joe may love you very much, totally gets me. They are very good at being so open to really exploring this either way. Your symptom might be MS, it might not, but let's find out for sure what it is so we can treat it. Dr. Green loves it when I bring my babies in, so last time I came in, I brought my now 1-year-old in with me, and it struck me, I see some of the people in the waiting room who are being assisted by their loved ones, maybe their spouse, maybe their child, who's now an adult. And I wonder, I look at my little guy, Liam, and I say, is he gonna be taking me in here one day? Is he gonna be helping mom in with a walker or in a wheelchair, carrying something for her? And what an odd kind of juxtaposition of seeing myself with my baby, and then seeing what potentially it could be. And the really hard, I think the hardest part of it all is I don't know. I could be just like this, but maybe I won't. I would like to say I have bright hopes for the future, but I would be lying if I said I wasn't scared of the negative possibilities that are there, unless we find a cure.
I'm inspired by the people that I see with multiple sclerosis. They are my heroes. I see people who are overcoming insurmountable obstacles. I see people who are making contributions to their families, to their friends, to the society at large, in spite of day-to-day coping with a significant and disabling disease. I love neurology, but I particularly love the care of MS patients.